I think you would need to unmute yourself.
I can try to maybe send him a message through the chat. Maybe he sees that.
Right, so you would just need to unmute.
C'est pour les participants du Niger. Est-ce que vous pourrez ouvrir votre microphone, s'il vous plaît?
Oui, on a bien ouvert le microphone. On est à l'écoute. Bonsoir tout le monde.
Bonsoir, monsieur.
Super. We hear you very clear. Thank you.
Merci bien.
Super. So I think we're ready to start. Neville, I would like to just welcome everyone for joining us today at the first of the two panels that we at Directorate are organizing as a part of sharing country experience with the COVID-19 infodemic management over the last year. This is a part of a larger conference, global conference that has been taking place over the last several weeks, and it will conclude in a final event next Friday on the 11th of December, which you're very welcome to also join in and listen to the discussions across different tracks of the conference. So not only with the country experience with health authorities, but also our discussions with the technology sector, with the civil society, media and journalists, and others. So I'm very pleased to introduce Neville Calleja. He is Director of the Directorate for Health Information and Research at the Ministry for Health in Malta, who is going to be our moderator today. And just before we start, I wanted to point out to you that we have interpretation available today in Spanish and French. You need to select the language in the horizontal menu on the bottom of your screen, and you'll be ready to go. So Neville, I leave us in your capable hands. Over to you.
Thank you, Tina. Welcome everyone from all sides of the world. So as our New Zealand colleague told us already, good morning, good afternoon, good evening to everyone. I would like to, a few housekeeping points, if I may. I would like to ask the speakers to keep their mics closed when they are not actually presenting. So like this, we don't interrupt each other. And I also ask them to speak slowly so that our colleagues, the interpreters, we don't give them too much of a hard time. So Tina has just showed us an interesting video, I must admit. So that's obviously about the 13 posters that have been submitted to the conference, and they can be viewed on the link that Tina is sharing. And yes, so we do encourage those of you who are listening to this webinar to ask the panelists. We have a Q&A function, and also there's the Zoom chat as well. I will try to pick up questions from your end, from the chats. There won't be, unfortunately, the time or the opportunity to ask verbal questions, but I will try, and to the best of my ability, to forward your questions, to put your questions forward to the panelists. Infodemic management. So the session today is effectively trying to help us understand how infodemic management can help us support the building of trust and credibility in health system emergency response. This is not easy because, like any other emergency, things can go wrong. New evidence comes along. The course of the health system response changes. So there are many factors that can provoke the infodemic to spread and expand, especially amongst populations that are most at risk. So we usually find that minorities are more at risk of infodemic, of being affected by the infodemic. And luckily, lately, we're seeing also the political class waking up to the existence of the infodemic, especially seeing it as a threat to vaccination campaigns planned for next year. So this is amazing progress, actually. And I've been lucky enough to have been involved in this new development with the WHO since early summer, when WHO started off drawing up a strategy for infodemic management. And just a few weeks ago, an amazing number, 278, I believe, maybe one of the WHO staff can correct me if I'm wrong, 278 people from all kinds of disciplines, marketing, health, journalism, have completed an infodemic management course organized by WHO HQ and are now actually doing their best to manage the infodemic in their own countries. So it's amazing how much this new science has grown in just less than 6 months. And it's very satisfying for me to note now, speeches, for example, at the European Council. I come from a European country, so I tend to be more well-versed, so to say, with the European agenda. But I was so happy to see this week statements coming from the European Union speaking actually about infodemic management. But you're not here to listen to me, you're here to listen to our esteemed guests. And I think I must at this point pass on the baton to the first speaker we have today with us. I'd also like to draw your attention to the fact that our colleague from the Philippines today could not join us physically, but nonetheless has sent his presentation as a recording. So without further ado, allow me to introduce John Kinsman from our continent, the European Centre for Disease Prevention and Control. John Kinsman is an expert in social and behavioral change communication, and I'm happy to note that you come from my same alma mater, the London School of Hygiene and Tropical Medicine. John, in your good hands.
Thank you very much indeed, Neville, for the introduction. And thank you very much for the invitation to take part in this fantastic conference. I feel quite humbled because I think I'm in the presence of really the collective world experts in this field. So I hope I can say something which is original and perhaps useful. I have actually 3 slides, and so I would like to see if I can share my screen. Is it possible for me just to do that, please?
You should be able to.
It says host disabled participant screen sharing.
Just a second. I will make you co-host. You'll be able to share. Please try now.
Okay, great. 1 second while we get going here. Okay, do you see the screen?
Perfectly, thank you.
Very good. There we go. Good. So what I'm going to do is to share, and I understand we have around about 7 minutes, so I'm going to try and keep to time. I'm going to share the preliminary findings from a case study project that we at ECDC, the European Centre for Disease Prevention and Control, have conducted this year on online vaccine misinformation. And we've conducted this work with some, I have to say, fantastic contractors, and I'm actually using their slides for this. We've conducted this work in 6 countries within the EU, trying to get a range of the different perspectives and experiences from different parts of the continent. So that's in Romania, Estonia, Germany, France, the Netherlands, and Spain. So we have a good range of experiences. And what we've done is to interview some people from each of the member states that we've participated in. And we've also spoken to people from various EU agencies and other large multilateral organizations to try and get a sense of some of the things that they are doing to counter online vaccine misinformation. So what we've got here is 6 points, and I suspect probably one way or another they will be familiar to you, but I just present them here as a framework for thinking about this issue. So we've got here number 1 on the left here, which is myth busting or debunking. And I'm sure you're all very familiar with this, of course. And here what you're trying to do essentially is to counter a specific piece of misinformation. So it is essentially a reactive process. Something appears and you try and want to show why it's inaccurate and address that particular issue. It's short term, of course, because it's only one thing that you're dealing with. And there's also the well-known risk that if you don't do it right, you amplify the lie. You might actually make people register this is an issue, and so therefore, in fact, you cement in people's minds that the thing that you're trying to get rid of, which of course is not what you want to do. We then have the second one, professional communication, which can also be defined as pre-bunking, whereby you're simply going out with your professional experts to provide the correct information. So it's a proactive approach. And what you're really trying to do here is to address questions that legitimately arise in people's minds about a vaccine. And of course, there's going to be questions right now about both safety and effectiveness of a COVID vaccine. Most of the target audience for this would be receptive audiences. So people who are already more or less open-minded. They're not people who are clearly going to oppose you from the start. A third way of addressing online misinformation is by supporting fact checkers. I won't go into a lot of detail here, but as you know, there's organizations such as WHO, which are actually they're maintaining data of materials that are circulating online. They make that information available. They are making it possible to check the accuracy of different information. Problem here is it's very difficult to keep it going. You have to keep it up to date. Number 4, ultimately, this must be where we should really be focusing in the longer term, because what we're talking about here is giving people the digital literacy to actually address with issues themselves. So they can actually look at something and think critically, is this good? Is this not good? Is this likely to be correct? And how can I find out if it's correct? Where can I go to check and verify if this is true or not? So this, in the long term, is likely to be a very valuable approach. But of course, it requires a lot of investment. It requires starting with people at a young age. And for people who are older and who didn't have very much education, it's already difficult to actually instill a critical thinking of this sort in this kind of area. So absolutely essential for a longer term approach, but difficult to do. Then we have working with the social media platforms, who of course we know are working also to report this information. There's been a lot of this in the press recently about different posts being tagged as being not representative of truth, or that there are different interpretations of this. So this is a big job for the social media platforms, and we have to work with them and to some extent trust that they're going to do what we want them to do, and hope that that's within their business model. Governments find this very difficult to do because you're then going into the area of censorship and censoring free speech. So this is a challenging area, and we need to work with the social media platforms to do that. And then, as Neville was just mentioning a moment ago, very important area of making this an issue with which policymakers are aware. They need to understand the importance of this. And I think the COVID pandemic has really distilled this in people's minds, the importance of understanding this issue, and policymakers are recognizing this is where we need to be focusing. So this is absolutely critical, and it, as Neville said, this is becoming more and more something that is happening. So those are the 6 broad areas which we have kind of developed as a frame. And as I say, I don't think those would be that new to you, but I think it may be just something that we can use as food for thought. The one bit which I think is terribly important is that, in fact, the methodologies for evaluating these strategies are poor. to non-existent. And I know that WHO is doing work, very innovative work, to develop new methods in this area. But to be frank, as we speak now, where we don't really know what works well and we don't really know what doesn't work. We don't have the metrics, we don't necessarily have the outcome measures that we can really focus on and get good background understanding of whether or not this is working. So while a lot of what I've said to you may be familiar, I really do want to stress this issue of proper evaluation. It's difficult. It's a huge challenge to come up with a new way to do this. We can't do randomized controlled trials on this sorts of things. So I think my challenge here would be to recognize that necessity is the mother of invention. We need to learn how to do proper evaluation of these strategies. And so I really throw the ball back to you collectively to think, how can we do that? And that would be my challenge to you. Thank you very much. That is what I had to say in my allotted 7 minutes.
Wonderful. 7 minutes precisely, by the way. Thanks a lot, John. Thanks for sharing this project with us, and I'm really looking forward to listening to the other projects as well. You definitely have structured, in a way, the approach pretty well with those 6 points, actually. So I'm sure they can act as guiding principle also for our discussion later on. So at this point, I'll turn to our next speaker. So we have to fly considerably west now to Canada. Lucie Marisa Bucci, I hope I said your name properly. I'm really apologize if I haven't. From Immunize Canada, Canadian Public Health Association. In your good hands. Let's hear about your project.
Thank you very much. I'm just going to share my screen. And I'll hope to stick to 7 minutes, so I'll go as fast as I can. But keeping in mind that there are some key points that have already been raised, so I won't dive into them too much. Firstly, I'd like to thank the organizers for this wonderful event. Unfortunately, we have an ongoing conference here called the Canadian Immunization Conference that is happening simultaneously, so I haven't had the benefit to hear all the marvelous talks that are coming out of here. So I hope to translate as much as I've gathered from the Canadian Immunization Conference to you in this presentation. And my goal is to lend some experience of that we've had at Immunize Canada dealing with different areas of the infodemic before it was officially called infodemic. And hopefully it can lend some knowledge to you. I thought recently the idea that the COVID-19 crisis stems from the infodemic as well as the pandemic is poignant, and that was a statement I've captured, or a heading I've captured from the OECD. And it really speaks to the fact that the infodemic has really heightened the good, the bad, the ugly from COVID. And this is something we've been dealing with at Immunize Canada for several years now, in different ways and in a less of a concerted, understandable, academic, theoretical perspectives. So it's very important to understand that the infodemic does impact the public's understanding as well as the healthcare professionals' understanding of what needs to be communicated and how to communicate. And I'd like to share with you the golden rule that we have at Immunize Canada, and that is coalitions work best. And working together is one of the key fundamental rules that we have at Immunize Canada on how to create concerted messages. And I think what we're doing here with the infodemic is understanding the nuts and bolts of how to do that. And so I hope to really just give you a high level view of that. And just to give you a bit of an understanding of what my role is, I run the Secretariat for Immunize Canada. And our mandate is really to be a national coalition with a specific interest in promoting the understanding and uses of vaccines as recommended by the National Advisory Committee on Immunization, which is our NITAG within Canada. We have specific tasks and activities that we do this, and this is one of them is education and advocacy, but I won't get into that detail right now. Just a bit of a backdrop and situational analysis for you. Canada's commitment to addressing the COVID-19 infodemic is really stemmed in several agreements, or I should say resolutions that, and groups that we are part of. So all of you know about the World Health Assembly that took place in May 2020, and we've agreed to all of those activities. As well as the OECD, we are a participating member of the OECD, and we are trying our best to meet the 4 key points mentioned in their report on COVID-19 infodemic. So how are we faring and what have we been doing up until now? Well, if you know a little bit about Canada, we are quite unique in terms of how healthcare is managed and how the infodemic is being managed because of it. We are divided nationally, federally, as well as by provincial and territorial jurisdictions who have purview over healthcare matters. Although there is some overlap when it comes to public health issues with the federal government. So nationally, the government has coordinated a strategy as well as some relative activities in response to the COVID-19 infodemic. And that is really mainly across several government departments and agencies. I've named 2 here, Health Canada and the Public Health Agency, who have been at the forefront. However, there are other departments such as Heritage Canada and many others who have also contributed to that strategy. Mainly their activities that are feeding into that strategy are to provide resources on COVID-19 disease, track misinformation, understand its impact on vulnerable population, monitor attitudes and behaviors, as well as understand the issues that impact trust in government and their interventions at both the federal level and the provincial and territorial levels. More locally, provincial and territorial jurisdictions have coordinated their own responses to the infodemic. I have not listed them because they're quite numerous. We have we have 13, 14 PTs in our country. However, there is a very good example here already within the circle of the WHO, which is Kids Boost Immunity and I Boost Immunity, and they've been tackling jurisdictionally the infodemic with their activities. So that's a great example. At the national and provincial level as well, we do have stakeholders. They consist of NGOs and academic institutions and professional health organizations that all have their own strategies for addressing the infodemic. And again, there's another example here. The University of Ryerson has a really good infodemic program right now. So how does that strategy and overlap and bridge into other challenges that we are facing with the rollout of the rollout of COVID vaccines? And what are our specific challenges as stakeholders in promoting resilience? Well, I'm sure a lot of in this list are familiar to you. We have lack of data on several of the COVID vaccines. We have uncertainty around the readiness to monitor adverse events in Canada. Distribution, target groups, who's going to be delivering and administering the vaccines is of concern to a lot of health professionals. And of course, all of the above are contributing to vaccine hesitancy and a call out for more information from health authorities. And of course, this scenario is impacting routine immunization as the focus has shifted onto COVID vaccine rollout. And so personally, within the whole scenario of COVID vaccine rollout in Canada, my experience is, well, the speed at which misinformation is traveling is fast. And my guess it's going to get a lot faster. And so if I can't keep up, what am I going to do to get that information to the people who need it? So just a little bit of overview of what's going on. Between August and now, actually, there have been many surveys. I've pulled up 3. And to give you an idea, in August, Statistics Canada showed that 57% of Canadians are willing to get the vaccine, are not willing to get the vaccine. 74% in October said they would not. And in November, an August Read survey showed that 1/3 of Canadians are not feeling motivated. So how can we improve our response to the COVID-19 infodemic and the vaccine rollout? As I've said, our golden rule is to work together. But if we look a little bit more deep in, or take a closer look at what we should do, we need to better understand the gateways for communicating with the public about the benefits of COVID-19 vaccination. And that may involve the prompt to receive seasonal influenza is still the best, the healthcare provider is still the best source of information. We need to explore outside the normal communication avenues such as caregivers, employers, use and understand and use media, health, and science literacy to our best ability. So for example, 12% of adults 65 years of age and over have competent matters in health. So health literacy, vaccination literacy, and science literacy is an issue. And because of that, we need to teach our population how to think critically and identify the con, which was so poignantly praised by Dr. Noni McDonald when it comes to the infodemic. We also need to be mindful about our target audience. We need to assess the perception of the benefits and risks, learn how to repackage scientific knowledge. We can adopt storytelling techniques to present science in a different way and creative new ways, understand the value of predicting rather than reacting. Social media listening and using triangulation techniques to gather data are our allies. And importantly, evaluate and collect as much data as possible. It's not always possible to pre-test our messages, but it's never an option not to do post-evaluations. And lastly, and this is something we're working very hard at Immunize Canada, do everything we can to improve the immunization experience for everyone. So we need to reassure the public that we hear the concerns, manage pain during immunization, and be there for when they need us. Thank you.
Thank you so much. What's intriguing, actually, how long has this function existed within Immunize Canada? So it's not a new function that started during COVID, right?
No, we've been in existence since just a little over 1993. So it's more than 25 years. So we've been addressing misinformation since then, and it's evolved, and we followed all of the best practices to do this. Indeed,
there you have it, guys. Misinformation is not something that was born in COVID, not at all. Indeed. And I love one of our statements actually on your slides. We have to look beyond the usual communication channels. A lot of people have this impression that misinformation travels only on social media. It does, and a lot, but not only. And it's actually even worse to address when it actually spills out of social media. So that's a very good message to hold on to. So thank you so much. In order to preserve time as much as possible, let's fly east again, but staying north to Finland. We've got with us Anna-Leena Lohiniva, Senior Specialist in the Health Security Department at the Finnish Institute for Health and Welfare. I must admit, the Finnish Institute for Health and Welfare in Europe has a very strong reputation, and it's probably one of the pioneers in public health in various streams. Anna-Leena, in your good hands. Thank you.
Thank you very much, and thank you for inviting me to talk here. I actually decided that I would like to share our experience, which is now directly linked to this COVID-19 pandemic, our risk perception monitoring system that we started to run since February 2020 in the very early times of the pandemic. And with that experience, I really want to, I think, highlight the importance of the context-specific interventions and the importance of going to the local level and going to the grassroots level when we want to change behaviors or when we want to influence someone. I think all of us in the public health, we like to think big. We like to run big surveys, and we want to create generic messages, and we want to reach many. But in the end of the day, as much as the reach is important, as much important it is really also to look into the context. Also, when we are there in the context, we also ensure always that the interventions that we are doing is really culturally appropriate. And probably the best way also to look into the context and really understand it is by using qualitative tools and participatory approaches. And I think this is also another issue that we often don't really maybe appreciate qualitative tools as much as we should. We may think that they are not so useful because we can't really have statistically appropriate or representative data coming out. And qualitative tools, we also think, oh, they are very hard, they are so time consuming, and they are complex. And I think often one hears that they are not really suitable for outbreak situations or using in the pandemics. That's because they are so complex. But this is actually exactly what we did now in Finland. We started to run a system that is collecting and analyzing precisely qualitative data to understand the risk perception of the public. The data was based on email messages that the public is sending to our institution, as well as social media interactions of the public in our sites. And the system and the analysis resulted into recommendations for risk communication purposes. So we had a multidisciplinary group of health and risk communication experts who discussed the findings and produced recommendations. I'll give you some examples of what we did, how simple the process has been. For example, we had a week where we had a lot of our data showed that people had a lot of concerns and misunderstandings about symptoms and signs of COVID. So that led clearly us having our recommendations to somehow simplify the information we were sending out to the public. And we also created some visualizations about the signs and symptoms that week. Another week, we realized that people had a hard time of applying the information that they were receiving from us in everyday lives. They knew about social distancing, they knew about the hand hygiene, but now the big question mark was among the public. You know, how do I do that when I go to the public transportation? What do I do? If I go to a crowded shop, what I was supposed to be doing? Or if I'm using elevator, there are other people, what can I do? So that we clearly, our team recommendations were to increase somehow the self-confidence of the public that they can actually protect themselves. And so we proposed a methodology for personal risk assessment, and we ran that introduction to this methodology through social media influencers that week in Finland. So basically what we did was evidence-based risk communication, contents, messages, and recommendations in real time. We've been running this twice a month. So twice a month we are getting real evidence-based recommendations. And this experience has been really great and really useful for us. That means, and also the messaging that we are having in our institution has also somewhat becoming more unified, because everybody is kind of going through the same system, at least thinking about the same discussions and same conclusions. So the outcome is also more unified. And perhaps the hardest part in this process has been the fact that we have this knowledge co-creation and we are encouraging and we want to discuss the findings and verify the recommendations that are coming out. And that, of course, in a real pandemic situation is not always ideal. But I think what has helped us also here is the fact that we have not created any kind of working groups or anything extra structures to it. Whatever we are doing within the systems that we have. When we have morning meetings or we have unit meetings, that's the place where we have been throwing the data we have and discussed and got it out. And after that, the whole thing has been disseminated in a very short format to as many people as possible within our organization. And now, since we have been so pleased with this startup project that we started, we actually are planning to join forces with some universities, and we start building a platform actually, and we try to bring some technology on board on this plan and get more data sources, qualitative data sources within that platform, and that hopefully will allow us then to manipulate more data and have even visualizations about it. So yeah, that was shortly the experience that I wanted to share with you. Thank you.
Indeed, very encouraging, I must admit, Anna-Leena. I mean, that was I come from a small country. We really don't have much resource to invest in new initiatives usually. And as you're saying, indeed, you can do a lot with very little sometimes when it comes to infodemic management. So it does not necessarily require major infrastructure. You can still do something about infodemic management. So indeed, very encouraging especially for those of us coming from low and middle income countries. So thank you so much about that. Just to remind our attendees, I am seeing some questions in the chat. If you can pose them, you have a little button just next to the chat called Q&A. And if you pose them there, it's much more structured and the speakers can engage with you directly. Then obviously we will have the opportunity to actually come back to them, and maybe they can give us some more elaborate response to your questions. So do please have a look at the Q&A, and also for your own interest as well, because there's a lot of interesting information being shared there. So I'm moving on to our next speaker. So our next speaker, okay, we're going to fly way south now. So our next speaker comes all the way from New Zealand. Kate Hanna, Deputy Director for Equity and Diversity. I'm afraid my Maori is a bit rusty, Kate, so I'm not going to try that. From the University of Auckland. So please, Kate, take us through your experience.
Ngā mihi nui kia koutou. Greetings from Aotearoa, New Zealand, where we are in the future. So we can maybe suggest some things for the past. It's always a fun time. I have got a couple of slides, but I really enjoyed how Anna-Leena just spoke. So I might ignore my slides at the moment and get to them if I feel like I need backup. So I work in a university, not in a public health organisation, and I'm a historian of science and technology studies. So the work that we've been doing on disinformation spread has been, as Anna-Leena actually really just described, really multidisciplinary, and has very much focused on mixed methods and a lot of rich qualitative data to try and understand the specific nature of the infodemic in Aotearoa, New Zealand. And I wanted to just highlight how that has panned out and how we are, as John indicated, trying to build into the research that we're doing some measures and metrics for understanding what works and what doesn't in a really situated way. So what works here in New Zealand, but thinking about what translations that might have for international peers like yourselves. So we've always had that process as part of what we've wanted to do. So in Aotearoa, we had a very clear set of government communications, a website and Instagram, Facebook, etc. messaging called Unite Against COVID-19, which was the go-to one-stop shop with all of the information about lockdown levels, about health interventions, non-pharmaceutical health interventions. It was regularly updated. It was incredibly well branded, and it was really, really distinctively understood and appreciated by the population. So we're currently investigating how different members of the community responded to that source of information, and it's been remarkably positive in combination with what we called the daily stand-ups, which were the talks every day, the reporting by the Prime Minister and the Director General of Health every afternoon at 1 p.m, updating us on the status of COVID in New Zealand, and the kind of triple tiers that we see of the mitigations against the infodemic were this remarkably well-trusted website, the presence of elected officials and public health, public servants, and then also the additional feature, which was the science communication or research communication by a number of really trusted individuals within the New Zealand media and social media landscape more broadly. And so what we found was this really developed into a coalition of public servants across agencies who understood what the threat was from the infodemic and were tapping into people like myself and other researchers, asking questions and trying to think about all of the issues that everyone else has already brought up. So right very early in the pandemic, for example, a senior communications official from the government asked if we would help assist with some debunking, a session with the Prime Minister doing some debunking. And we all said, oh no, we don't do debunking, that's a very bad idea. How about we do something different? How about we do some pre-bunking? And what was organised was a session with the Prime Minister and the Prime Minister's Chief Science Advisor and two very influential key science communicators. So Dr. Michelle Dickinson, who's internationally known as Nano Girl and who does science shows for children, but is based in New Zealand as a New Zealander, and also my colleague, Associate Professor Susie Wiles, whose work is in combination with Toby Morris has gone on to be part of the World Health Organization's visualizations for how we understand the infodemic. And so these four women sat down and just talked about some of the things that children might be concerned about around the pandemic, and why we have to have hand hygiene and how that looks, etc., etc. And that was a really, really much appreciated and much shared piece of pre-bunking against some of the myths and concerns. And what that means is that now that we're entering into the phase, thinking much more clearly about the vaccination resistance that we're going to see, that we expect, is that there are all these relationships in place with trusted individuals across that spectrum of elected officials, public servants, public health people, and other scientists and academics who can be go-tos and can work with community leadership. So that's kind of one of the spaces that we're really interested in. But the work that I will share, and I'll just quickly jump on to share my screen, sorry folks, desktop share, and there I will go. So this is one of the beautiful graphics by Susie Wiles and Toby Morris from the spin-off, but I'll quickly flick through to the work we're working on now. This is a lovely diagram done by a young woman that I know of this trusted sort of trio, a combination of academics, public servants and other leaders who were being listened to help us unite against COVID-19. The project we're working on now is understanding that idea of situated community resilience, focusing specifically, as most of you are now, on vaccination and related health and wellbeing interventions. And if I come from the future, well, the community that we're working with comes from the very tip of the East Cape, which is the first part of New Zealand to get the sun. So very much the first part of New Zealand to be the future. And this is a quite isolated Māori community, mainly Māori community of Ngāti Porou, that had really strong community resilience and support self-generated during the periods of lockdowns in March and April. And we want to understand what that community-led resilience looks like and how that influences vaccine uptake. And so what we're going to do is work with local storytellers, local wisdom holders, to develop, co-develop in that participatory way that Anna-Leena spoke of, some vaccine-specific narratives that are grounded in culturally contextualized ways of thinking and being and doing, and then test them out in that community, and then do further testing in other parts of New Zealand with other marginalised or minoritized communities, refugee and migrant communities, those who are more vulnerable to the pandemic itself, so disabled and other communities, to see if these stories have resonance and increase community resilience and the uptake of vaccination as a good, a public good, working away from this idea of herd immunity, but actually what the collective responsibility is in kind of a collective mode of thinking. And this is the really exciting work that we're about to start working on now. I'll stop sharing my screen. So I just wanted to sort of finally talk about how the mask wearing situation in New Zealand has shown the ways in which that community resilience and close connection and relationship have really shown how, given evidence to how those things work well in a public health intervention mode. So early on in the pandemic, mask wearing wasn't one of the public health interventions that was strongly encouraged in New Zealand. During the court, where I guess we're a quite small population in a relatively large country, so socially distancing, apart from in the big city where I live and work, perhaps is easier. But it became more normative, and increasingly over time we had developing and changing scientific advice about whether mask wearing should become something that New Zealanders would do. And again, it was that combination of increasing scientific advice, acknowledgement by scientists that their opinions had changed, so that early on they hadn't advised mask wearing, but now they were changing their mind and saying that mask wearing was good, in combination with both local and central government saying, look, we want people to be safe on public transport, we want people to be able to go out and live their ordinary lives now that we're no longer in a type of lockdown. So what can we do? Can we bring mask wearing into this situation? And so from a couple of weeks ago, we're in a situation where mask wearing is compulsory here in Auckland and Tāmaki, Makaurau on public transport, and it's also compulsory on flights, with internal flight rules. And we're seeing so much more uptake of masking. People are really relatively chill about it. We've got beautiful fabric masks being made all over the country, and that's been a really interesting transition from something that wasn't seen as necessary to something that is now seen as necessary and is having large-scale uptake. So again, ngā mihi nui ki a koutou. It's wonderful to talk to you all, and I look forward to having more chat after we've all had our allotted 7 minutes.
Tēnā koe. I'm not sure if I said that right. Thank you. Indeed. So I must admit, the world has been looking at New Zealand with intrigue during this pandemic. I must admit, so I guess I can say this as a member state, WHO could never say this, but not all of us can say that we have had a prime minister or a president or a country leader who was actually in tune with public health and actually so much as you're actually discussing here, sitting across a table and actually talking about misinformation agenda, so that she's actually up to date and making sure to address this in her speeches. So it's interesting to see how different misinformation is in New Zealand as opposed to other countries, given that there was this possibly, can I call it, harmonious approach to the pandemic at political level as opposed to other countries, or maybe it was not so harmonious.
It's interesting because the research we're doing about the misinformation and disinformation shows that clearly we are all getting the same disinformation, and it comes in waves from certain jurisdictions, quite strongly from Europe, from the UK, and from the US and New Zealand because of English language.
The English language, yes.
English language. But it manifests in quite situated ways. So there was a big outbreak of disinformation related to a cluster that happened in August when Auckland went into lockdown again. And that was very specifically grounded in specific racism against a particular cultural group in New Zealand. And so that needed to be mitigated by working closely with community leaders. But that's what happened. The public health interventions, public health units and community leaders went out into the communities and worked through that. So it's the same stuff, it just manifests itself in different ways, I think is probably.
Indeed, you mentioned a good point that I'd like to reflect on before moving on to the next presentation. Just a couple of weeks ago, Germany enacted some new legislation addressing misinformation. And they've, let's say, stifled quite a few misinformation channels originating within Germany. I must admit, as an infodemic manager here in Malta, I felt the effect. Somehow within Europe, there was this overflow of misinformation from these groups based in Germany. So what you're saying is indeed very relevant. This misinformation does not know any borders, and action done in one country is likely to affect pretty much so many other countries, especially through social media. That said, I'll move on to the next speaker. The next speaker comes all the way from Niger. So Dr. Abashi Ranau, I hope I said that well, and I apologize if I have not, Secretary General of the Ministry of Health in Niger. Dr. Ranau will be making his speech in French, I understand, but we do have interpretation services in other languages as we've had till now. So, Dr. Ranau, à vous.
Merci bien. Merci de nous avoir donné la parole pour partager avec vous notre expérience en matière de gestion de l'infodémie. Donc, je suis secrétaire général du ministère de la Santé publique, mais aussi président du comité national de lutte contre la pandémie de la COVID-19. Et comme beaucoup de mes prédécesseurs l'ont dit, la gestion de la pandémie a été difficile du fait effectivement de ce flux important d'informations qu'il va falloir gérer. C'est à cela que nous nous sommes attelés. Je voudrais exprimer juste quelques secondes pour partager ma présentation avec vous. Est-ce que normalement ça doit m'amener. Je vais ouvrir ça. Je vais ça ici, voilà. J'espère que c'est bien affiché, c'est bien visible.
Oui, c'est visible.
Est-ce que c'est bien visible? C'est bon? D'accord, oui. D'accord. Donc, comme je le disais, bon. Nous avons mis en place, merci bien. Donc, le Niger a mis en place, effectivement, dans le cadre de cette lutte-là, un comité multisectoriel, dont à l'intérieur duquel il y avait cette commission que nous avons appelée la commission en charge de la gestion des risques et engagements communautaires. Sachant bien qu'effectivement, il y a ce problème de gestion d'informations, il fallait que cette commission se mette au travail pour apporter beaucoup d'éclairage en termes de gestion de l'information. Nous avons également développé des actions de sensibilisation à l'endroit des communautés, des religieux, des lieux religieux. Nous avons utilisé des technologies de l'information et de la communication pour la diffusion de la bonne information. Et ce qu'il faut savoir dans ce dispositif, c'est que la gestion de l'infodémie a été de manière, j'allais dire, informelle, parce qu'on n'avait pas une stratégie national de gestion de l'infodémie. Mais vu la circonstance, effectivement, nous nous sommes donné les moyens de faire face et de gérer surtout les mauvaises informations, les rumeurs. C'est ainsi que, comme beaucoup l'ont dit également, pour permettre au public d'apprécier la bonne information, parce que l'évaluation de la bonne information n'est pas toujours aisée. Et nous nous sommes dit qu'il fallait trouver un moyen pour donner la bonne information. C'est ainsi que nous avons recruté un social media monitor. Et social media monitor, il avait comme tâche effectivement de faire le croisement des informations à travers tous les médias sociaux, de capter l'information, toutes les informations qui concernent la pandémie. Il fait la synthèse avec un outil que nous avons utilisé, et cet outil-là qui permettait effectivement d'apprécier, d'objectiver la véracité de l'information, ce qui nous permettait de sortir une information qu'il va falloir maintenant partager avec le public pour contrer la mauvaise information. C'est ainsi que, après ce travail du moniteur, on analyse cela chaque jour. Chaque jour, il vient, il présente les informations collectées, et on dégage maintenant, par rapport aux mauvaises informations, les réponses appropriées qu'il faut apporter. Et pour le passé, maintenant, on est conscient qu'on a traité l'information, on a la bonne information, il faut trouver les bons canaux pour passer l'information au public. Le comité, il s'assoit, il désigne les personnes appropriées, les personnes qui peuvent être écoutées quand elles vont parler à la télé. Et ces personnes-là viennent maintenant présenter l'information traitée à travers le canal de notre social media monitor. On passe l'information à travers donc la télévision, à travers les radios, à travers les réseaux sociaux. Si la personne parle, maintenant on utilise les autres canaux, notamment ce qu'on appelle les influenceurs ou les influenceurs digitaux, qui sont les grands influenceurs, les grands leaders sur les réseaux sociaux, qui passent l'information, qui prennent le relais. Donc, on a plusieurs relais que nous utilisons. Il y a donc la personne qui a la notoriété, qui vient parler à la télé, qui vient parler à la radio. Il y a les influenceurs digitaux, mais aussi la même information, nous la donnons au niveau des médias de proximité et à travers les leaders locaux religieux qui donnent l'information. Et cela a été très, très bénéfique parce que dans certaines régions de notre pays, nous avions une localité, effectivement, il a fallu passer par ces réseaux-là pour étouffer l'épidémie parce qu'il y avait des comportements inappropriés, parce que tout simplement les gens n'y croyaient pas, ils écoutaient toutes ces informations à travers. Donc, il nous a fallu utiliser ces leaders locaux, ces jeunes locaux, pour contrer et amener effectivement à étouffer la maladie et la pandémie dans la localité. Je crois que ça a été très, très bénéfique le fait qu'on ait utilisé ces réseaux sociaux, ces leaders locaux de proximité pour apporter la bonne information, parce que quand ça vient d'eux, les populations y croient, les populations prennent ça comme effectivement la bonne information. Ils sont en train de traduire. Donc, voilà les éléments, ce que nous pouvons donc résumer, ce que nous pouvons retenir comme leçon apprise de cela, c'est que malgré le déni, malgré le fait que les gens n'y croyaient pas, et du relâchement que nous avons observé, le fait qu'on ait passé ces informations a amené les gens à observer des comportements responsables dans certaines conditions. Et c'est ce qui a, dans ces localités, amené la région, amené ces leaders locaux vraiment à mener le combat, à passer l'information pour que les gens soient suffisamment imprégnés. La mise en place de ces influenceurs, nous pensons que c'est quelque chose de très, très bénéfique parce qu'on utilise tous les différents réseaux. Et tous ces différents réseaux, on cible les personnes qui sont influentes dans ces réseaux pour passer les informations et les bonnes informations pour contrer. Il y a également, donc, comme je le disais, c'est l'utilisation de ces scouts-là, de ces jeunes au niveau des communautés. L'implication aussi de certains groupes sociaux, certaines corporations comme les forces de sécurité a permis d'avoir accès effectivement à ces groupes vulnérables spécifiques pour leur apporter la bonne information et les amener à comprendre, parce qu'ils vivent dans des conditions de proximité qui sont très, très importantes. Donc, il va falloir leur apporter l'information nécessaire. C'est cela, en fait, les leçons que nous avons tirées. Et aussi, nous avons utilisé d'autres moyens, d'autres canaux en donnant des numéros, en utilisant toutes les compagnies de téléphonie du pays. Nous leur avons donné un numéro et ces messages clés d'information. Donc, la personne, quelle que soit sa langue, nous avons 9 langues, nous avons mis ces messages dans ces 9 langues-là avec un seul numéro. Donc, dès que la personne tape sur le numéro, elle a besoin de l'information, elle va sur le numéro, elle tape tout de suite, elle est redirigée vers le message de sa langue avec un numéro qui correspond à sa langue. Il tape le numéro et tout de suite, il a l'information, la bonne information qui le concerne. Donc, vraiment, les nouvelles technologies ont été d'une contribution très, très importante. C'est ça qui nous a même permis de faire pratiquement le traçage de tous les contacts des malades à travers notre dispositif. Donc, voilà en résumé ce que je peux dire par rapport à notre expérience de ce que nous avions mis en place comme dispositif qui nous a permis, en tout cas, de juguler et de bien gérer l'information au niveau de notre pays. Je vous remercie. À vous.
Si. Merci beaucoup. Thank you, Dr. Renau. It's very encouraging to see someone in a... Merci à vous. It's very encouraging to see someone in a senior position like yourself engaging so deeply with the infodemic. And one important lesson I'm taking from your presentation is that infodemic management is not so much about restricting misinformation, but rather about feeding the right information, which you clearly have shown us was the case being done in Niger. So congratulations on that. Thank you very much. We have one last speaker to listen to tonight. Well, tonight for me, of course, different time zones for you. And this one is recorded and it comes all the way from the Philippines. So we shall be having a message from
We're ready to go.
Madumba, yes, public health physician in the Philippines. Yes, Tina, it's in your hands.
As individuals are now facing the biggest crisis of our generation, the decisions people and government take in the next few months will shape not just our healthcare systems, but also our economy, politics, and culture. We're not just fighting a pandemic, we're fighting an infodemic as it plagues the COVID-19 outbreak. Fake news and misinformation of data are easily prevalent in this digital age. As such, we are recognizing the danger of widespread sharing of medical misinformation, especially in a pandemic, as it undermines the trust in health institutions and programs. Many short-term emergency measures will become a fixture of life, as such is the nature of emergencies. Since the COVID-19 situation happened in the Philippines, infodemic management was regarded with higher importance as it can affect decision-making processes when immediate answers are expected. Thus, the Philippines COVID-19 Infodemic Response Task Force was made composed of volunteers from national government agencies, development partners such as the World Health Organization and UNICEF Philippines, media and public affairs representatives, and the academy, with the Department of Health at the helm. For the pre-COVID-19 pandemic, the infodemic management system is arbitrary. There are no criteria set in screening which mis or disinformation to address, and interagency coordination on health rumor management is quite weak. Content-wise, however, the DOH has always been accurate and materials are thoroughly vetted by concerned technical offices. As infodemic management during COVID-19 has been prioritized, synergized coordinated efforts in addressing the mis and disinformation have been done by the various volunteers of the Philippines COVID-19 Infodemic Response Task Force. Infodemic management became one of the foremost pillars of the DOH COVID-19 communications campaign, dubbed as Be the Solution sa COVID-19, or translated, Be the Solution to COVID-19. The Philippine government adopted a more systematic, coordinated, whole-of-government approach in addressing dis and misinformation on COVID-19 related issues. The DOH is now looking towards upscaling this to cover all health-related concerns. As a result, a total of at least 57 fact-check materials on critical and urgent issues related to COVID-19, mis and disinformation were released by the department as of writing. Audiences are diverted to published policy documents or the DOH official website for access to more information and for issues that require elaboration and educational reinforcements. Subsequent explainer videos were also produced. These typically highlight actionable points for the public to follow. All Finnish communication materials are cascaded to our regional offices for localization and for distribution on the ground. The issue on tuob, or steam inhalation, as a treatment for COVID-19 stirred up controversy nationwide sometime in July, one of the most exceptional rumors or misinformation that confronted the DOH that requires immediate action. Many Filipinos, especially those residing in rural areas without immediate access to hospitals, practice the steam inhalation, or tuob, or the traditional method to relieve themselves of mild COVID-19 symptoms. Such practice was deemed harmful as it may prevent COVID-19 patients from seeking proper medical attention by relying solely on the method for a cure. It may also be a cause for burning accidents. The department released a series of materials to address this issue, utilizing various platforms in social media denouncing the use of steam inhalation as COVID-19 treatment. Through the COVID-19 virtual presser, an official release, an alamin Be in the Know card, or other social media materials. Content for these fact-check materials are reviewed by the professional medical societies for accuracy and translated to the vernacular for easy comprehension. Saturating multiple platforms with the same message was a key action to achieve such level of compliance and cooperation, as people need to trust public authorities. The media and the department made continuing efforts to debunk this myth. Thus, the issue died down. This simple action saves lives as the people of today seek to verify factual information. In a moment of crisis, minds too can change quickly, as these are not normal times. It is not too late to rebuild people's trust in science, medical factual information, public authorities, and in the media. As we prioritize rumors to address, we make use of new technologies in the digital age to consistently saturate the publication of fact-check materials, as this information should enable people to make informed personal choices. As we fight infodemic, shifting the thinking from reactive to the preemptive, taking early measures are crucial as we need to share factual information, thus being the big advantage of humans over infodemic and viruses. Plant eyes in the community to develop responsive content tailored to local needs and language, as we keep in mind those people vulnerable to mis and disinformation. We need a spirit of global cooperation and trust as we collaborate and foster partnerships to expand reach as correct messaging is amplified and reinforced in people's minds. As we choose solidarity and responsibility in healthcare to fight through this pandemic, it will be a victory not only against this coronavirus infodemic, but also to the future epidemics and crises that might come.
So that was our friend Dominic from the Philippines. It's a pity we don't have him with us, but I don't blame him. It's 3 o'clock in Manila right now, so definitely not a good time for questions. But I picked up one word which Dominic keeps repeating, and I think it's critical: saturation. the social media particularly tends to get saturated with wrong messages quite naturally, actually, be it because of the human nature itself, or because of algorithms within certain social media pushing those messages. So sometimes it's an uphill struggle. Well, not sometimes, but actually most of the time, it's an uphill struggle to saturate these channels with the right messages. So that is definitely a good point. At this point, there are, I understand, some questions. Lots of questions have been posed in the Q&A. Thank you so much. I could also notice that many speakers have engaged directly with some of the attendees, but I believe we have two specific questions wherein the speakers would like to answer verbally. And I think I'll turn first to Kate. I understand there was somebody, Dr. Papel, I understand, who posed a question to you.
Yes, thanks, Neville. So the question was, what have been the New Zealand pain points regarding overcoming misinformation and disinformation regarding the pandemic? And this, I thought, was a good opportunity to highlight that, as all of the colleagues have highlighted, that this infodemic, which coincides with the COVID-19 pandemic, takes place in the broader context of misinformation and disinformation and so-called fake news and other threats to civil society and democracy, that New Zealand in particular has been very, very concerned about over the last 2 years since the tragic events in March 2019, where 51 worshippers were killed in a mosque in Ōtautahi, and with the proliferation of white supremacist and extremist material online that followed that event. And so that has been sort of one of the features of, I guess, what I think of as a bit of a pain point in New Zealand, is we were working really hard prior to the outset of this infodemic to join up government agencies, academia, and conversations with the platforms. As Neville, you highlighted the issues of platforms right at the beginning of this. We were working really hard to build consensus and build programs, and many of you would have heard of the Christchurch Call, which is around moderating those platforms. And it's almost like we've gone a few steps backwards because of the nature of the infodemic. But what it has also meant is that because of the public health emergency that COVID-19 is, we are having more joined up experiences across government in New Zealand. And I think all of you, many of you are coming from public health or health related organisations, but obviously when we're thinking more broadly around misinformation and disinformation and the threat to civil society, we need to involve so many different parts of government in those conversations, and we all know how difficult it is to involve lots and lots of different parts of government. And so that has been a pain point, but it's also been a kind of a success, or the beginnings of a success. So there is a lot more ongoing conversation happening across those agencies around what this specific infodemic means in the context of those broader threats to human flourishing, health and well-being, and civil society that we want to think about. And I do just flag that a colleague from Brazil, asked a really interesting question around media ecosystems and political systems, and those are key questions because the infodemic manifests really differently in different media ecosystems. So I thought that was a fantastic question that I would like to answer live. Happy to talk about these things forever, so I'll be quiet now.
Indeed, Kate. Unfortunately, in some countries, it might actually be dangerous for a public health physician to state the right information when you have senior political figures spreading misinformation, because it might be taken as a direct affront. So indeed, having the leadership on your side is definitely a big plus point when it comes to infodemic management. I must admit, I personally have had situations where I had to deliver the right information, which might not have been precisely the same message of that the leadership was transmitting, the political leadership was transmitting at the time. It's not easy, and you have to choose your words wisely. And maybe we can have a chat, in 5 years' time to see if, somebody chops off my head in the meantime. But, it's our job, I'm afraid, as public health physicians and infodemic managers to indeed spread the right messages, because this is something we need to understand. The infodemic kills just as much as the epidemic by spreading the wrong messages. So thanks, Kate. Thanks for that insight. I understand we have another live answer from John. John had a question from Antonio. John?
Thank you very much. Yes, the question came through here. I'll just read it out. What techniques are effective in your countries for social listening, collecting feedback from communities, and tracing rumors and misinformation? How do you analyze it and take into consideration for policy and decision making? So these are really interesting questions, and I just wanted to, I thought this is the kind of thing that needs a little bit of discussion, because essentially what you've got, in the way I see this, you have two different questions. The first question, two rather separate questions. The first question is about how do you do social listening? How do you actually collect data regarding what's going on in the community and what people are being misinformed about and rumors that are spreading that are incorrect? And there are actually a number of different tools for that. And I'm not going to go into the details of it, but those things do exist. There's software that you can buy. It's not cheap, but it is available. And it's technically feasible to do for online social media monitoring, essentially. And through that, you can get a pretty good sense of issues that are going on. You can also identify particular actors who may be active in spreading this information. And within Europe, within the EU, there are some countries who have very sophisticated social media monitoring groups. But I would just say that this is, and I think this is an area where collectively, globally, we need progress, because it's not a small task to undertake this, because the amount of misinformation or the amount of information that's available is so huge. When you do this, it's a really big task. And then to synthesize that and figure out what's actually coming through, what is going on, and finding the relevant and the key bits of information that you need to, the misinformation that you need to be addressing, is very, very difficult. So these techniques are there. Unfortunately, it requires resources and it requires technical capacity, which for some countries is challenging. So that's the sort of reality of that issue. But of course, it's very relevant and it's a good investment, I think, if you want to focus on what's out there. The second question you had is, how do you analyze it and take it into consideration for policy and decision making? And I think in a sense, these are two separate areas, because what you would be, the fruit of that first effort to do your social media monitoring and get that material out would be to help you define how to counter it in a very direct way through risk communication efforts, through community engagement efforts. And possibly it's not necessarily needed to go all the way up into the decision-making sphere. In the specifics, if one rumor comes out, you don't need to get the Prime Minister to counter that, unless it's something very particular, of course. But then if you look at where we are right now in the pandemic, I think there are two broad areas that we need to be looking at in terms of countering misinformation. One is issues to do with adherence to the preventive measures. To what extent are people still practicing social distancing, still wearing masks, still avoiding parties? That's one issue, which is highly relevant for the coming months. No way around it. The vaccine is not going to make a dent for at least some months. The second area we need to be looking at is the vaccine. And these are very different when you're looking at misinformation. The key area with regard, as I would see it, with regard to the preventive measures would be issues to do with masks, because the evidence on masks has been dynamic. And I think in the beginning of the epidemic, we saw a lot of uncertainty. There's still uncertainty in some respects. And I'm living in Sweden. Sweden is not a place where masks are recommended. You see increasingly a few people wearing masks in the shops, But honestly speaking, it's a rarity compared to many other European countries. So masks are an area where misinformation could be problematic. But I think really when we're looking at issues for policymakers and decision makers really to intervene is in regards to the vaccines, because this is make or break in the future, in the very short period of time from now. And I think it is absolutely essential for leaders to be advocating for vaccinations and to be very publicly saying this is what we need to be doing. There are questions and legitimate questions in many people's minds about safety. And I think a lot of people are saying, well, I'll wait and see if my neighbor can take it, and if he's okay after a couple of weeks, I'll think about it, kind of thing. And I think a lot of people have that feeling. But I think that leaders, if you're looking at getting policymakers and decision makers into the fray on this issue, I think that the leaders need to be really, really promoting vaccination very, very strongly. And just to give one positive piece of news from the United States, I think we can say that as of today, former presidents Clinton and Bush and Obama have all said that they would be willing to do the COVID vaccine on film live, as it were. And I think that's the kind of thing that is a very positive step, where people who, whatever your political affiliation may have been, you'll say, well, these guys are doing it. Okay, maybe I can do it too. So I think this is the kind of thing we should be looking at as a way to show the way forward. So thank you, Antonio, for your question. I think this is your questions are very close to my heart, and I would love to engage further, but I think I'd better stop now and give somebody else a chance. Thank you.
Thank you so much, John. In fact, indeed, we are getting a bit tight on time. I would encourage you to maybe, if you can manage to answer a couple more questions that there are in the Q&A, but we're a bit short of time now. So I'm just going through our panelists today and asking you for one final statement. I'd like to ask you, in your opinion, what would be that 1, 2 at most recommendations that you would put forward to health authorities to do more of in 2021 to promote the resilience to the infodemic and health misinformation and to promote healthy behaviors? John, I'm not sure whether you'd like to add anything on this.
I can just what I said at the start, which is I think it is absolutely essential that we improve our capacity to evaluate what we're doing. I think that's really where I think the focus needs to be. We need to be more rigorous, but I very much strongly agree with Anna-Leena when she's talking about the use of qualitative methods. I'm a medical anthropologist myself, so let's also definitely include qualitative methodologies in the evaluation. But please, let's evaluate. Let's figure out what's working well and do more of that. And the stuff that's not working, let's stop doing it.
Thank you so much. Lucie, any final thoughts? Maybe one recommendation you would give us for health authorities?
Yes, I have to agree with John. Evaluation is a major component. We cannot proceed without understanding what we're doing right and what we're doing wrong. So that is my last thought on what we've discussed today. Thank you.
Indeed, very strong message there. Anna-Leena. Any recommendation you'd like to make for health authorities for 2021?
Yes, I think I just want to highlight again the same message that I was giving in the beginning, that I really think that understanding the context and going to the grassroots level is really worthwhile, even in this pandemic situation, that it isn't that difficult and as complex as many times we think about it. It's really the essence to do things right. If we want to see changes, we really need to understand the community and the context. And we have to accept that we live in the very multicultural society. It depends where we are. We have these subcultures of subcultures. And if we want to get across our messages, we really need to take that level. And I also agree with John and others that the importance of evaluation is very important, since we really don't know that well what works. But I also want to stress that I think we have to also be kind of gentle to ourselves and accept that we can also do less rigorous evaluations and still accept they are fine. We don't always have to go for and think that we have to do random controlled trials to be right. I mean, I think we have to be inventive and try to find simple ways also to collect lessons learned as we go on, because we just don't have the time to be so sophisticated at all times. This is a big issue, and a lot of disinformation is circulating around. So to try to be inventive and find other ways also to evaluate, I think this can be also, it can do good things to this infodemic management in general. Thank you.
Thank you, Anna-Leena. Thank you for your intervention. At this point, I turn to Kate. Any final recommendations?
I agree with all of my colleagues on the panel that particularly the idea that grassroots qualitative work is still worth doing even in emergencies, and that we can evaluate as we go. I mean, participant organised research, we can build evaluation in qualitative ways. That means we can at least say this is good enough. It doesn't have to be perfect, it can be good enough. And that there will always be situated knowledges that will be specific to jurisdictions, but there is always something that we can share as well, because in the end, all of the stuff, all of the disinformation works because it comes from people's place of fear. And when we can engage with people in a relational way and think about kindness and addressing those fears, that's a human interaction that cuts across jurisdictions and spaces and places. So I tend to be optimistic that we can do some good in this space if we keep working.
Thank you. Thank you so much, Kate. And finally, maybe our friends from Niger have any final recommendation to share with us? The microphone.
Excusez-moi, je viens d'activer le micro. J'espère que vous m'entendez maintenant.
Yes.
Merci bien. Donc, je disais, en matière de gestion de l'information ou de l'épidémie de l'information, il y a 2 ou 3 éléments qui sont importants, à mon avis. Le premier élément, c'est d'objectiver l'information. C'est-à-dire, quand il y a une désinformation, il faut chercher à l'objectiver. Et maintenant, pas de contrer l'information. On ne doit pas contrer la désinformation, mais on doit objectiver et apporter l'éclairage, la bonne information. Et maintenant, une fois qu'on a la bonne information, par quel canal on doit la passer? Il faut, quand on va envoyer quelqu'un à la télé, que ce soit la personne qui est écoutée. Pas la politique, pas autre chose. La personne, quand elle va parler, elle va être écoutée. Ça, c'est de un. Deuxièmement et troisièmement, il y a aussi des canaux importants qu'on ne doit pas négliger. Quand il y a la bonne information, il faut vite les utiliser. Ce sont les influenceurs digitaux. C'est les réseaux sociaux qui sont influents. Quand vous les utilisez, tout de suite, la bonne information va passer et ça calme la situation. Donc, également, en dernier lieu, les leaders communautaires, parce que nous avons vérifié avec eux, nous avons vraiment étudié et utilisé ces leaders communautaires-là. Ça nous a permis rapidement de circonscrire la situation, la pandémie dans une certaine localité. Donc, ce sont des canaux, je pense, que, sur lesquels on peut s'appuyer pour contrer ou en tout cas apporter l'éclairage par rapport à une désinformation. Je vous remercie.
Merci beaucoup, Dr. Renaud. So there we are. We have a very, very strong message from all panelists today to evaluate, not necessarily, using rigorous methods, but speed is of essence. And indeed, as our last panelist has just highlighted to us, then we need to act on what we learn through the evaluation and provide the right information through the channels that are available to us. Infodemic management, remember, is not about suppressing misinformation as much as it is about spreading the right information. So from my end, I noticed that the time is up. So I guess that's it from my end. I'm not sure whether Tina would like to add anything.
Just really my sincere thanks to all of you. This has been such a great session, and I've been taking notes. The lessons and recommendations you've put down, it's something that we need to elevate even more. Really, thank you so much on this, and I think we've found in this panel also a lot of people and experts that we can work with over the course of the next months in learning from you, and how we can also at WHO support you better. So thank you, Neville, and thank you to everyone. I would, with this, conclude the panel. And as you're leaving, I actually wanted to share with you the video from the Infodemic Manager training. Maybe some of you saw it at the beginning of the training, but you haven't. This is just a conclusion. I just wanted to give you a greeting from all of our Infodemic Manager unicorns that have been with us for the last month, discussing many of the things, and I think they would also find it very inspiring, the experience and the richness of the recommendations that you've shared with us today. So thank you very much, everyone. And thank you, Neville.
The biggest infodemic management issue in Mali is COVID-19 disease denial.
Overload and harmful messages on COVID-19, both online and offline, are making it hard for Nigerians to follow health expert advice related to the pandemic.
One of the biggest issues for infodemic management here in Kyrgyzstan right now is that people, including medical workers, seem very unwilling to get a potential COVID vaccine because they are afraid that they will get sick with COVID if they get it.
The biggest infodemic management issue in Serbia currently is effectively promoting the healthy behavior of wearing a mask in closed spaces and keeping a distance, and intelligently discussing the benefits of a safe and effective vaccine.
मेरा नाम उमर है और मेरा ताल्लुक पाकिस्तान से है. Infodemics remained an issue in this country due to the belief of general population that herbal remedies are more effective in prevention of COVID, and this belief actually brought a change in the behavior. So instead of having face masks and social distancing, they started believing protected by using these herbal remedies.
The belief that COVID-19 is just a simple flu has become popular in our country. Many say, look, people just recover, so let's just self-medicate.
Social inoculation, debunking, fact-checking, and social network analysis are some of the key insights we have tackled during the Infodemic Manager training. Actions speak louder than words.
I'm trying to use my knowledge and skills as an infodemic manager to debunk that misinformation on my social media and several social media platforms. Also, I'm using the risk communication and engagement team in my office to make sure this misinformation is being tackled.
And the key insights gained from the course for me will include being where the people are and winning over the undecided. I think these are the things that I'll put in my toolbox as my smart strategies as an infodemic manager.
I'll be using my IM skills to further my research into misinformation and how it influences health information-seeking behavior. And I'll be designing interventions that guide people to accurate and reliable health information.
With the government starting this month the national vaccination campaign, we are facing a huge level of mistrust and misinformation from the population, and I hope to engage in community engagement and behavioral change as well as social marketing to help the government optimize people's behavior and encourage them to engage in vaccination.
The key insight I got from this training was the opportunity to build strong relationships with colleagues in other countries who are dealing with similar circumstances.
Saya Jumatil Fajar, manajer infodemic dari Indonesia.
Hello， 大家好，我是来自北京大学的黄杰。
Ndị banye kene mụnụ, aha m bụ Dọkịta Chiduka Ọhazụike, nwafọ Igbo n'ala Nigeria, abụ m infodemic manager.
Ago Nkwanyenye Erasmus Gidimajo, Chogana.
मैं हूँ रश्मि पोपी इंडिया से और मैं हूँ एक infodemic manager.
Dobar dan, ja sam Stefan iz Srbije i ja sam menadžer infodemije.
أنا دكتورة نجوى خميس من القاهرة من مصر، بعمل في إدارة المعلومات المضللة infodemic manager.
Hello everyone, my name is Sarwakas from Morocco and I am a young infodemic manager.
안녕하세요. 저는 한국질병관리청의 김윤아이고 현재 미국 CDC에서 근무 중인 infodemic manager입니다.
Salamat sizlerle. Ben adım Laura Evans, men Kyrgyzstan'da yaşayım, yana isteyim.
Ako si Dr. Iris Tiel Isiptan, isang infodemic manager.
Hi, I'm Anna Khan from US CDC in Atlanta, Georgia, and I'm an infodemic manager.
Sunana Kabir Isa Ado daga Nigeria, kuma ni infodemic manager ne.
Soy Diego Espíndola de Medellín, Colombia, y soy un gestor de la infodemia.
Ngayong adlaw, ako si Kay Bukal, gikan sa Cebu, Philippines. Isa ko ka-infodemic manager.
Hi, my name is Lynette and I'm from Australia and proud to be an infodemic manager. The key insight from the WHO infodemic management training that has stuck with me is that infodemic management is a process, not an end state, like community engagement, building trust, learning a new language, staying healthy and fit, and of course being in love. You've got to be in it for the long haul.
There's comfort in knowing that we're not alone, and together we're stronger.
Great. Thank you, everyone. I hope to meet you virtually soon. And thank you, Neville. Thank you, everyone. Have a really good evening. Have a good morning. Good night. Bye.